Again on another bit of truth breakdown. What's good, my Patreons? We're gonna talk about some things here. We're gonna get into a mixed bag video, but first we're gonna talk about these body parts for sale right here. With them basically have a system where they supposedly be using body for studies and all of these things, but ending up selling bodies, people. Dead body parts. We're gonna get into this right here, and I'm gonna show you how wicked this side of the world is that you live in. This right here is hell that you live in, and they're using the human being parts, people, as commodity. Can you believe that? And we talk about the organ transplant and all of these things, and people donating organs when they're dead, and all of these things is satanic work on this side of the earth. You best believe none of it is living righteous here on earth. After they give you these ways to live, and then it damage your body. The way of life damage your body inside and out. And then they're going to come up with the solution, selling body parts. We're going to talk about it a little bit because this is a dangerous route they're taking with the masses. Just make it run.
Focus on the good things in our lives.
This is the newest image for Abtin Nasiri, a former chiropractor turned self-help guru who just 9 months ago was operating MedEd Labs, a now bankrupt Las Vegas-based company that leased human body parts for medical training and research.
Hold on, people. They lease human body parts for training and research. You hear that, people? I don't understand how the human come to this right here. So therefore, a lot of people gonna leave their body when they claim that they sign it on paper for when they die, they can get their body to use as research, sent all over the world for research because they claim that they need to study the human beings even when you're dead. Take a listen to what I'm saying here, people. They need to study you even when you're dead. How you think the manipulation happens to you right here when you're alive? They already know you. So what is they tricking the masses under false pretense? Have them signing over their body so they can sell it. That's how they do it in a devil earth, people. I already told you this is hell. Listen and watch.
Part of the shadowy and lucrative body broker business.
There you go, people. Body broker business. That alone tell you, you don't live in a righteous place. You don't live in a place where the human beings considered as supposed to be, precious. You understand what I'm saying? If you can sell human being body parts, what a damn joke, people. Body broker business. Take a look at that right there for a second and let it sink in. Take a listen.
Brokers take those bodies and they will many times cut them into parts and ship those parts to different users. The heads may go one place, the limbs
different users of what, people? They're sending them all over the world for different users of what? You send the head someplace, you send the hand someplace, you send the foot someplace. For what kind of study, people? They already know you inside and out. That's how the manipulation gets to happen. So why they bring you this shit right here with this body broker? Take a listen here.
Another place.
Nasiri began MedEd Labs after losing his chiropractic license for misconduct. He pivoted to the body trade. But as he did, NBC News has learned he also left a trail of scandal and allegations of unethical conduct along the way.
Of course, he lost his job in one field and now he go into the body broker business. Take a listen to this.
Claiming he used company money for personal expenses like family vacations and his wife's false eyelashes.
His wife false eyelashes? What kind of bullshit is this, people? All in the name of selling body parts, human dead body parts? Wow, listen.
Complaints from medical school officials that he mishandled human remains, allegations he denies.
Listen.
Here in this Vegas strip mall, in a suite between a psychic and a tattoo parlor
was the between a psychic and a tattoo parlor. You got the body broker business right there in the middle. Take a listen to this right here, people. You're gonna understand that you're living in hell real soon.
MedEd Labs office. It's here where they received and held dozens of bodies, which they obtained from different places, including funeral homes and the University of North Texas Health Science Center.
And the University of Texas Science Center. What kind of dumb shit is this, people? How they come by these supposedly bodies? The university. People donate their body. You hear what I say? People donating their bodies to these people right here, some criminal, wicked people on this earth. Listen again.
The Health Science Center, which was at the center of our investigation earlier this year, provided Nassiri with dozens of bodies and body parts. In emails obtained by NBC News, the center alleged he shipped remains back in dirty containers, including one likened to a scrap cardboard box, that he failed to return nearly 20 feet, and that he was holding more than 30 of the center's bodies for far longer than...
They mentioned 20 and 30 code in Freemasonry. But take a listen to what they're saying right here, people. They're talking about the human being body parts. Can you believe it, people? Wow, unbelievable.
In MedEd Lab's maxed out freezers. In 2021, Nassiri also made national headlines for supplying the body of a World War II veteran who died from COVID to an event that was charging $500 to view a public dissection in a hotel ballroom.
Hold on, people. So a veteran died from COVID. That's what they tell you. You know already. That's part of the world stage. Nobody died from no fucking COVID. It's just another hoax that they give you right there for the pandemic. So what is they telling you right here? The whole thing is a fake shit for the dumb masses. That's what you need to understand. But they have to bring these things to you so you understand. Take a look at this right here. You see it? Wow, unbelievable dumb shit. $500 they're charging.
Nassiri telling NBC News he didn't know the body would be used in that way, which the group that conducted the dissection disputes. What bothers you the most about that?
It all bothers me. We should be treating these individuals with more respect.
You should be treating these individuals with more respect. I don't understand if those people that donate their body, I don't know how they come by these bodies. I'm just saying, say for instance, it is what I'd say it is, where they sign off that when they die, these universities can use their bodies as studies and these things. But everybody's brainwashing to this right here. You best understand the people that sign over their body were stupid. So therefore, all of these things, they never think about it before they donate their body. That they could be shipped all over the place in a cardboard box. Dissect up in pieces and sent all over the world. They didn't know that. Okay.
Dr. Tom Champney is an anatomy professor who helps oversee the body donation program at the University of Miami, where medical students...
Wow, they said body donation. So people donating their body to these cars. You see how dumb the world is. For whatever reason, they convince you that it's a good thing to do. You buy into it.
Are shown pictures and told life stories about their donors.
Clothing.
My goal is to start early on humanizing these individuals.
Is there any regulation of this?
Oh, you have to humanize these individuals because they're not human, right? They're not human because they're dead bodies. So now you got to humanize them. This is the dumbest shit in the world, people. Why they allow these business to function. You don't understand with them having those supposed to be cremation going on. You best understand all of it is a trick. So yes, people, you supposedly have a dead person in your family. You pay these people with a furnace to burn the body and give you back a cup full of ashes. That's what they give you. Do you really know or for sure that your family member was burned to that ashes that they gave you? You don't know for sure. And those urns that they give you is sealed. Most of them, they give you in a sealed metal container, meaning you can't go in there to declare what they're actually giving you for ashes. So worry about what they're going to do with the body itself, people. They never burn them. A lot of cases. I did video on it already with some funeral parlor, some place was in Florida that was keeping the body that they were supposed to be burned and giving the people fake ashes. Giving the people fake powder substance for ashes while they keep the bodies piled up in the back. Do you understand that that's what the news bring you and tell you, look, these people can do these things? But I'm saying, people, are you sure that they're cremating your family members when they give you that ashes or the so-called ashes, because they need these bodies to sell as parts? You don't understand that or not? Why you think people can donate their bodies and their body parts when they're dead? It's part of it, people. Most of those cremation place actually in the body broker business, selling body parts and organs and everything. Just when you think your family member burned, they half somewhere selling in pieces. That's what you need to keep in mind. Again.
there's very little regulation. There's no licensing. There's no requirement to accredit any of these groups.
There's no inspection.
No
one's going to med labs. Checking out what's going on.
Of course not. In fact, there's probably more regulations about what you do with a refrigerator than there are what you do with a body.
There you go, people. More regulation of what you do with the refrigerator than what you do with the bodies. You hear what I say? So therefore, people, like I say, a lot of times your family member, what they tell you happens as far as the body itself, they lie. They need it to sell for parts. And for the wicked people of this world, yes, they need body parts. Don't be thinking that it's in the name of supposedly, health and these things to save other live people with dead bodies. It's bullshit. 100% in. But the devil people show up their hands right there. They have to do these things to the human being's body because they themselves is not humans. That's what you need to understand. Fallen angels operation right here to sell the human being body parts.
Nasiri, who canceled our sit-down interview, defended MedEd Labs, saying we respect our donors. It's an incredible gift. But his practices
it's an incredible gift, people. They respect the donors. It's an incredible gift to donate your body to these peoples. They know you already. They know you 100% inside and out. They don't need a dead body to figure out humans. Why did they do this, people? They talk about research. They lie. This is not for research. This is a devil act they're doing right here on the earth. Move.
Tonight, an NBC Bay Area exclusive. The State Justice Department has launched a criminal investigation into Contra Costa Health, which is a major East Bay healthcare organization run by the county.
Meanwhile, another State Department says the healthcare system is taking action to fix problems exposed by our exclusive report. Investigative reporter Candace Wynn broke that story. She joins us now with the impact that's having, Candace. We spoke with the nurse who blew the whistle when officials failed to listen to her concerns about...
You see the hand sign on this one right here, people? Pay attention. It's all deception, but you have to understand what's going on in this world. You depend on the medical industry to basically save you, keep you healthy and nice in this world. But you're dead wrong. That's what's gonna be your destruction. That's how they set it up. The things that you lean on gonna be your destruction here. Take a listen.
Harm, even patient death, she says. She spoke with us, and tonight she is revealing her identity.
Even patient deaths. Listen.
I think that it's wrong. Disguised in shadows.
And don't trust nobody that they bring on TV talking about disguising shadows. Talking about they blowing the whistle. Don't trust them, people. And then they're gonna tell you the news company put this out. So that's why they get some result or get some answers of what's going on in that hospital. Pay attention.
When we first heard from her in May, it's been heartbreaking. It's been really heartbreaking.
Fake crime.
Contra Costa County nurse manager Irene Graham says her tears have turned to conviction and she's stepping into the light.
Oh, they convict somebody? Okay, there you go, people. That's the person that was behind that silhouette that they show you. I already told you, don't believe in TV. This is a way bigger person that they show you in the first clip. Do you understand? It's fake shit for the masses, but this is how they do it. They have a lot of things going on in the medical industry that baffle the masses, and they come to clear it up. Listen.
A story came out that actually was part of my, like a breakthrough in relief for me, because it meant that this story was being told.
Enhanced Care Management, or ECM, is a state benefit that's supposed to serve the whole patient, both their medical and social needs.
Their medical and social needs. Do you hear that, people? Pay attention. They're not even going to look out for you medically unless you're talking about social needs. What a damn joke. Listen.
Says since 2022, Contra Costa Health Plan has been ignoring medical needs and as a result harming Medi-Cal patients through its ECM program.
Listen.
Contra Costa Health Plan serves roughly 200,000
you see them right there, people. Pay attention to the logo right there. Got two pyramids. That's what it is. And the sunray right there. Matter of fact, 3 pyramids if you look on the sunshade right there. It basically form a pyramid underneath. And I already told you, CC for 33 there. Right there. No mistake, no coincidence. Take a listen.
Medically complicated community members members. This email shows last year Graham reported falsified medical records to county leaders. Patient visits, she told them, were labeled and billed to the state as public health nurse visits when either no visit took place or it was handled by someone without medical experience.
Listen.
How do you have firsthand knowledge of that?
I witnessed it myself.
The problem resulted in serious harm, she says. Graham reported a patient dying after his bed sore turned into a bone infection.
You hear that, people? Even death. They're talking about bed sore turning into bone infections. Wow, I told you, people, the world is a wicked place you live in. And don't worry about it. All of these things gonna inflict on the masses. And they're just gonna show you these things on TV, but it will never make a difference. Do you understand? It will never change what actually happening on the ground.
Another patient, she said, died after receiving no health interventions for a year. We reached out to Contra Costa Health, including their CEO, Anna Roth. They refused to answer our questions, saying the issue is a confidential personnel matter, even though their spokesperson at the time talked about it in an earlier interview. We're hearing concerns that visits are being labeled as public health nurse, PHN visits, but they're actually being conducted by staff members who aren't nurses.
So, I mean, I guess I don't...
You know this right there, people? McCall, that's a coding right there. The Kim McCall is a coding Freemasonry. And I told you, people, there's a lot of these things going on worldwide. The mass is not aware of it. So you see, when the news bring it to you, they act like they're coming to your rescue. They're shedding a light on it. It's still gonna go on, because if they never tell you, most people wouldn't know. So how you gonna know that the problem is solved? Move.
A synthetic drug now finding its way into the community.
There is a new synthetic drug that find its way into the community. You hear they reading these things on the news? It makes it look like it's just regular people come from out of nowhere with these damn medications. I already told you they're made in the same labs that give you the over-the-counter medication and prescribed medication. It's the same people producing it. It's not street people giving you these new drugs, people. It's them. The same government people serving you up these shits. Like I said, even methamphetamine, cocaine and all come from the government. So don't worry about these pills that you see in the streets. It's all government shit to destroy the people.
Concern over protonitazine.
Listen.
It's considered 3 times more powerful than...
Of course it's 3 times. Codeine, 3 times more powerful than fentanyl. Remember what they tell you about the fentanyl? They act like it's something drug dealer is making to kill people. But it's them, put it in the street. Then you need opioid because you're addicted to that shit. Then say give you for pain medication, you're gonna be addicted. So now the people's addicted to that shit and the doctor not gonna prescribe it for them unless it's under the table. So now they're scrambling, looking for that shit for the fix. And what they're gonna serve them up in the street? Tell me what? Fentanyl. They're gonna disguise opioids in the fentanyl, basically. Give you that shit. I'll give you fentanyl disguised as opioid, I should say. So when you get that wicked fentanyl in your body, they tell you, yes, it's street people give it to you, or street people serving it up. This new drug that they say now is more potent than the fentanyl, people. The fentanyl that they tell you, even if you touch it, it could have some kind of, wicked effect on you, even if you just touch it in a plastic bag. Now they tell you they have another one with a name. That means it's them. They're the one who are responsible for this one that they claim is 3 times more potent than the fentanyl. What kind of shit is this? Are you still gonna believe that it's drug dealer cooking up that shit and serving it in the street, people? Listen to this.
And being blamed for at least 1 death here in LA. Eyewitness News reporter Carlos Granda has the details.
As soon as the new drug come in, they know about it right away and start putting things on it. They know these drugs right away. As soon as somebody get hurt by it or die by it, they know exactly what it is and can brand it as a new drug in the street and how potent it is. It's the same government people bring it to the table and give these news people these reports to bring you.
Frightening lab-produced drug, protonidazine. It is so powerful, the FDA never approved it.
Yeah, that is so powerful. The FDA never approved it. But who bring it to the table for approval? Who did it? Oh, I forgot. It's the street drug people, the street drug dealer bring it to the FDA for approval, and they didn't approve it, so now they have to just sell it in the street illegal. This is bullshit for the masses. The same thing I tell you about fentanyl. It came from the government people. It come from the same medical settings. It's something that they use on patients in the hospital. You understand what I'm saying? They're the one who bring that shit to the table to use on you. And then when they suppose they be serving you up in the street with it, they're the same one who do it. They want people to be high on these drugs. So then they can come tell you it's the street people and drug dealers serving you up those wicked medications. It's the same thing as medication. Listen.
Illegal in the United States. Has no medically accepted.
Where is it legal? It's illegal in America. Where else does these pills at and it's legal there? This is a joke for the masses here. So yes, they tell you the FDA never approved it, but it's in the street still. Okay.
But it is still finding its way into the
what
community.
What a fucking joke.
Case last
but
month.
Where does it come from, people? Where does it come from? Who bring it for the FDA to approve it? What company? Because you don't have to look far if you know the company that bring it for the approval. Okay, so say for instance, just talking here, say for instance it's Johnson & Johnson, just word speaking. Johnson & Johnson bring this medication, this pill to the table to the FDA and say, hey, we want to check if we can put this on the market so people can use it for such and such. And then the FDA tests it and said, no, this is some dangerous shit. We can't give you this shit. We can't give you a go-ahead to serve this shit up. So then you find it in the street. Who you gonna blame? I'm just saying. Just simple ways how they can figure it out if it's this way it happens. Okay? So that company comes to you trying to get these drugs approved. It didn't approve, but anyway, it's in the street and you don't blame that company. You don't look into that company and say, listen, you was the only one bring this shit to the table. You the one who create it. You the one who bring it to the table and we turn it down. How did it end up in the street if it's not from your hands? You see what I'm saying? Easy case solved. But they would never tell you what company bring it to the table because they're not the culprit. The culprit is cartels from Mexico's and drug dealers, right? All world stage.
Los
Dumb
Angeles
shit.
federal court charged one man for
They go to Freemasonry, people. Freemasonry represent the peoples who control you here. What does it mean? I'm just saying. Real talk. If they use this eagle seal right here for the world government, basically for everywhere you go, you see it. Represent the government peoples. It's Freemasonry people. They're running an operation on the world.
The drug. Court documents say this is the first confirmed protonidazine death-resulting case
You know the
in
name.
the nation. Protonidazine is quickly emerging as a fentanyl replacement,
Hear that?
and it is 3 times more fatal.
Wow, it's quickly emerging as the fentanyl replacement, people. Even though it's 3 times more potent. Remember, the fentanyl is a killer. That's what they've been telling you. They call it an epidemic in America. The amount of people dying and sicking and, getting a certain wicked things because of that same fentanyl. That's what they tell you. But they're willing to replace it with something 3 times more deadlier. That's what they just tell you. It's a replacement. Wow, unbelievable. As they have up the top of his head right there. Substance abuse. You have to understand, this is what they do, people. All of those medication that they make, it's gonna make you addicted. What it do? It alter your damn brain, making you want these things, even though it's bad for you. That's why you have all these addictions of these medications. Why you think the addiction happens? The medication alter your brain. Yes, so you feel like you need that shit in your body. That's what they call addiction. Anything that make you addicted, it's alter your brain to make your brain feel like that's something that you need, and then bam.
Prospect of nitazines being out in the community drug supply is certainly worrisome because that increases the risk of overdose. When you have a very potent chemical that is small.
You hear that? They admit it, people, a very potent chemical. Remember, that's what make medications. You hear me, people? Don't let it take you too long to understand the world. Don't be that dumb. All wicked chemical made up medications. You see how easy they can go back and tell you it's a wicked chemical now that they're exposing that particular medication? All medication made out of some wicked chemical that man or human being should never put in their body. But it's the destruction world. So they tell you different. Do you understand?
It's going to be the difference between being comfortably high and not breathing anymore.
Experts say it is being shipped in from overseas,
you
usually
see that?
China.
There you go again, people. It was shipped from overseas, mainly China. You see it, people? China always pay the scapegoat. Who don't understand that yet? That is just bullshit. It's the same American government pumping these things on the American people. Why they need Chinese to poison you here in America, and they have the damn government of America to govern you and poison you? Do any damn bad things in the book. Your destruction depends on them, the ones that run you right here. That's why they assigned somebody to run you in this side. China government responsible to destroy the Chinese. This medication was designed by Americans for Americans. 100% in.
And press fake prescription drugs
fake
and
prescription
put them out on the
drug.
streets as if they're
It's
legitimate.
bullshit, people.
Retired DEA.
Put it in the street like it was legit. Who is buying medication in the street legit? Is that real? Who is buying medication supposedly in the street and believe that they are legit for say? It is bullshit for the dumb people here.
Agent Bill Bodner says stopping these shipments coming in through customs is almost impossible.
Okay. Yes, of course it's impossible, but you can stop a regular man from transporting drugs, though. You can stop regular people from doing it, but you can't stop China from pumping it into America. That's what you just said, that is China is coming from. It's coming from these places, mainly China. Why can't you stop it from coming in the country? It's dumb shit for the masses.
It takes so little of it that the packages coming in are so small. It does not take much to mass produce fake pills.
It don't take much to mass produce fake pills. So they're coming in from wherever country they're coming from in a small number, and I guess when you get to America, they multiply it because it's potent, I guess, concentrated. It is bullshit. Wake your ass up with a bam.
A relatively small package, have it get through customs, not be searched.
Get through customs.
Officials say, fortunately, they haven't seen a lot of it yet. The advice.
Yeah, I mentioned yet. They haven't seen much of it yet. You best understand what they're doing here, people. And now, there they go with the Narcan. Narcan nasal spray. I guess that's for the overdose. Wow. I told you, people, look how they back you up in destruction. Or you run from one problem, bam! You jump into the next. It's like hopping out of the frying pan right into the damn fire. You believe in these things right here, the Narcans of the world? Take a listen.
Piece of an overdose is to use Narcan.
There you go.
With these
you're going to have a bigger problem.
Like nitazines, we are sometimes seeing instances where people need higher doses of naloxone or Narcan.
Yes, and they don't responsible for those supposedly medication that get you overdose, but they can bring you a Narcan for the antidote. Is that real? I'm just saying, people, how can they bring you the antidote real fast for these things? But they didn't create it. It's some wicked people created it outside of America and shipping it in here. You don't get it, people. How can they have the same, antidote for it? Punch you with that shit and you're good again. But they don't have nothing to do with the damn thing that poison you to begin with or overdose you. Don't believe in the government, people. They're full of tricks. And don't worry about it. The masses already got into these modes already. They're looking for these medication, these pills. That's what they pop for supposed to be a good time. These street drugs that they got in this world nowadays. people popping them for party and having fun and all of these shits and then ratting out their damn brain. What a wicked world. Move. Now take a look at this right here, people. This is a new way. They're gonna show you around here that, you know, all these people that need health insurance don't have it, especially these kids. Now we seeing that supposed to be, you know, manhunt that they was having for this man that they claim shoot this healthcare CEO, meaning that these people's in charge of these insurance company for your healthcare, the healthcare insurance industry. They tell you that, you know, they're denying people claims, and that's why the Luigi, as they call him, commit that murder, killing that CEO. But you have to understand, it's all trickery to open this gate right here, people, because a lot of people been denied insurance and coverage. Now they're going all the way down to the babies. Let's see what they're talking about.
At first glance, Isabella Quintana looks like so many toddlers. But what you can't see are her health challenges.
What's like to have a 16-month-old daughter?
16-month-old daughter, but hold on here, man. Hold on, go back. The hell is this?
At first glance, Isabella Quintana looks like so many toddlers. But what you can't see are her health challenges.
What's it like to have a 16-month?
Hold on here, people. Look at this character clothing. What is that? Wow. Forming the diamond right there in the middle. Upside down pyramid. That shit look like a horned creature shaped out on the hat. All by design. You even see the rainbow colors in the back. All kind of agenda right here in plain sight.
Daughter. There's no health insurance coverage.
No health insurance coverage.
It's a lot of things all the time, you know. And it's hard for us because we're like always thinking when she's going to get sick, you know.
Her father, Gorman, says Isabella should be covered by Medicaid,
Listen.
the government program ensuring low-income and disabled Americans.
You hear that, people? Yes, they insure disabled and low-income Americans. You hear that, people? I already told you that's the Medicaid system. It's no good, people. You better understand. They can put you in position where, yes, you can go get some checkups and these things, and you pay less money than you usually pay if you didn't have that insurance. But when it comes to finding these things, and then now you have to do these operations and these big things going on now, costing your money and everything. Now the Medicaid gonna drop you or don't cover that plan, don't cover that coverage, or serve you up for you to get some money to do this, or you have to come out of pocket to do it. When you feel like you have Medicaid, here comes the destruction.
Summer, she lost coverage, even while her brother kept
lost
his,
coverage
due to what her parents believe is a paperwork issue.
Listen.
They say since then, a bronchitis follow-up appointment cost around $1,100 out of pocket, a big chunk of the roughly $35,000 the Colorado family makes a year, which is why another time the family tried to wait out a fever, hoping Isabella got better at home.
Wow, they tried to wait out a fever, hoping that she get better at home. So they rather keep the sick baby at home because they don't have the medication coverage. Do you understand that, people? That's what the world gonna bring you now. Especially right here in America. They're gonna talk about coverage and whose claim was denied. That's what they put on the table with that fake manhunt with the Luigi character. You understand? It's a damn crisis actor. Play around with the people.
After the COVID public health emergency, the federal government required states to reevaluate every Medicaid recipient's eligibility. The process, called unwinding, caused more than 25 million people to lose Medicaid coverage.
There you go, people. 25 million people lose their coverage right there, people. Medicaid coverage. Why? Why is it happening, people? Like I said, the government people want you to believe that they're down and to save you and everything. But when it comes to these things, you left us out. Why? How? If the government people are supposed to look out for you, you trust in them, you believe in everything, you run behind them when it comes to these things, and then later on they leave your ass out.
For procedural
what a
reasons.
joke.
As of August, more than 5 million fewer children were enrolled. And overall, it's not clear how many Americans who lost coverage were actually still eligible.
So in August, you started trying to get it restored. And here we are in December.
Yeah, and nothing.
The exit has created a paperwork backlog. And while unwinding largely ended in the spring, kids like Isabella appear to still be facing the consequences.
It shouldn't take 4 months for that connect to happen.
No, it shouldn't. And if that happens, there's something wrong. Something has fallen through the cracks.
Kim Bimstever oversees Medicaid in Colorado, where unwinding sent safety net enrollment plummeting more than 30%.
Wow, coding 30.6 is a coding, 3.6 is the mark of the beast code.
150,000 people lost health insurance through the state's safety net programs. Nearly 150,000 of them children.
There you go, people. That was all by design. Nobody is stupid. That was all by design. And like I say, people, they don't care about the peoples themselves. All of it was fake. It was all fake also, people, when you see them acting like, oh, we want to give your kid Medicaid and we want to help them and we want to help you. Here's some food stamp. Here's some stimulus. They don't care about you, people. All of these things that they're doing is just to look good. But at the end of the day, they are about the destruction, and you're going to see it show up when it comes to these Medicaid and these insurance when it comes to the medical industry. The whole thing gonna come crashing down on the masses.
Watch, California has declared a state of emergency after America's first severe human case of H5N1 bird flu.
So you hear that, people? The bird flu struck again. This time in California, and they have a state of emergency in right there, people. Can you believe it? So hold on here, people. The bird flu is still on the table. It's gonna show up as a pandemic. I already don't tell you. Listen to me, people. All of it is by steps. Just like they give you the SARS and all of these things, and then later on they come up with the COVID and they tell you tied to the same SARS. Do you understand what I'm saying? It's the same thing they're doing right here with this bird flu, that they're gonna make a pandemic later on. They're gonna basically, school you as far as how it mutates and all, where it come from to get in the humans and everything, and then later on, they're gonna show you the human-to-human transformation or transmission, and then they can give you the damn pandemic. Then they can give you all the drama with you staying away from people and masking up and everything, and take precaution, including shots and everything gonna be on the table for this shit. You best wake up. And also, it ties to the food supply. I keep telling you that so you remember that. They might tell you, yeah, we gotta raise up the price of eggs, chickens, and all dairy product and cow meat, because all of that shit is now vulnerable, and they're gonna tell you we have to take out a lot of cows, we have to kill a lot of chickens and throw them in the trash, throw away a lot of eggs and milk and all of these things. So now the price gonna go sky high. It's part of the new destruction that they got coming up for the world, people. You best pay attention here.
The Louisiana patient is in critical condition with severe respiratory symptoms following exposure to sick and dead birds.
What do you mean, people? You just mentioned after exposed to sick and dead birds, that one person exposed to sick and dead birds. What the hell is you just say? So he was exposed to sick and dead birds, and that's the reason why he have the bird flu. Okay, I got you. Listen.
The 61st confirmed human bird flu case this year. CBS News medical contributor Dr. Swain Gowder, editor-at-large for Public Health.
Don't laugh with the one-eye symbol all over the place.
Joins us now. Good morning. How are you doing?
Morning.
All right, so what do we know about the condition of this patient in Louisiana, and how did they get it?
So this patient we know is over 65, has chronic medical conditions.
You say over 65. You just say 61, man. Wow. I may be mistaken. Is there show 61 on the screen? All right, let's go back. It's nothing to do that. Let's
News
see.
joins us now. Good morning. How are you doing?
Morning.
All right, so what do we know about the condition of this patient in Louisiana, and how did they get it?
So this patient we know is over 65, has chronic medical conditions.
Chronic medical.
They are in critical condition at this moment and in the hospital. They appear to have been infected by a backyard flock of birds, not commercial.
Is that stupid, people? Is stupid shit. He affected by a backyard flock of birds. He affected by a backyard flock of birds. So listen to this, people. The birds that flying around is now a danger to you of giving you the bird flu. A flock of birds. What happened? Did he touch the bird? Did he cage them up? What happened? How did he get the birds, the bird flu from the birds, a flock of birds? What happened? They're flapping their wings and some dust come from them and he inhale it and he have the bird flu. What's going on? Please tell us. Don't do that. Don't do this right here. Please tell us exactly how the man get the bird flu from the flock of birds. Stupid shit for stupid people in this stupid world.
So is it the same strain as what's going on with dairy cattle?
Yes.
It is not the same
You
strain.
hear that, people? It's not the same strain that's going on with dairy cattle. They're gonna keep bringing you to these strings and strings until bam, they tell you that's the one that gonna mutate with humans to humans. Exactly what I tell you gonna happen for this pandemic with the same bird flu, but the stupid shit.
Strain that we have seen in wild birds, and also the strain involved with the teenager who was hospitalized in critical condition from
so
H5N1.
all of them coming in strings, people, just like they tell you with that COVID. They come in strings and different strings, attacking different peoples and different things. It is bullshit, but it's the world stage. They're setting up for their destruction. Nothing else gonna come from it but destruction.
British Columbia,
Bam.
Canada.
So people at home hearing this are going to say, well, so he was handling birds. Is there a concern now, though, that people could pass it to other people?
There you go, people. That's all they want to get to. Yes, the man was playing around with birds and he catch it. But all they want to get to is when it gonna get from human to human. That human get it from a bird. Look how life is stupid, people. Listen how life is stupid. We and the bird don't have the same built up, but they can give you a flu. The bird don't have a fucking flu for real, but you can still catch a real flu from the bird. You hear what I say or not? You're gonna have these fever, these cough, these mucus and everything coming out of you. The bird not gonna have that. But the bird can easily pass off that virus on you. But hold on, you can pass it off to another human. You and the bird don't have the same built up, but the bird can pass the virus on to you. But you have it and can pass it off to other human. Why did you believe these things? Why? Later on, they're gonna tell you start moving from human to human, and then bam, that's your pandemic right there. They're gonna tell you, yes, state of emergency, and they're gonna give you, public alert and all of these things, and then all of a sudden, the bird flu is on the table as a pandemic. That's what they're doing. They're taking their time, but that's gonna be the end result.
Very good question. So yes, his exposure was sick and dead birds. So
sick and dead
for those of us at home,
how did he expose to sick and dead birds? What is a sick bird? A sick bird fly down and sit right there for you to play with? What happened? How did you get contact with a sick and dead bird? It is bullshit for the people here.
Do not handle sick or dead animals. Call animal control.
Wow, but, don't handle sick or dead animals. Call animal control. They're playing with us, people. They're treating you like some little young babies in this world because we all play dumb, living by this system, and what this system have to offer, we suck it up. What a shame.
In terms of human-to-human transmission, the concern is the more we allow spillover into humans, the more likely at some point you might see a mutation.
There
that
you
would
go.
allow.
You might see a mutation the more it spill over from birds or animals to human. The more you see that, the closer we're going to get to the mutation where human can transmit it from another human.
For human-to-human transmission.
There you
Because
go.
most people don't come in contact with sick or dead
Look at this right here, people.
So,
look at the clothing. Look at the clothing right there, people. You don't understand what's going on here? It's a devil trick TV is. And they use it to bore a hole in the human being's brain.
how big of a concern should all of his feel watching and listening to you.
Right. So for the general public, the risk is still exceedingly low.
It's
the people
low.
who are at risk are farm workers, people who handle domestic.
They don't have no farm workers, people. All the things that you see in the store that come from a farm supposedly did not. It come from the government people. GMO food you're taking in. None of those supermarkets have a farm. Where did they get farm goods from? You better wake your ass up. All of it is government stage for this world that you live in. Nothing about it real. Or high risk for bird flu.
Animals, livestock. And really, don't drink raw milk. It's really not a good idea.
And there you go, people. Don't drink raw milk. You know what they call raw milk? You pump it straight from the cow and drink it. That's not good. It need to have some kind of chemical in it, else you're gonna be poisoned with the bird flu. I'm gonna ask you a question. Does the cow that you're getting the raw milk from have to have the bird flu for you to catch it? From the raw milk. I'm just asking you, are the raw milk automatically gonna give you the bird flu, whether the cow have it or not? And is that sound stupid? Because it sounds stupid to me that the cow have the bird flu passing around in milk. The cow people, the cow have the bird flu. I guess you're going to have a cow flu later on. They have a monkeypox. They have a mad cow disease. They have all of these shits. They have a chicken pox. They have a bird flu. You hear what I say, people? I want to know, why is the cow taking that bird flu so serious? Why is the cow taking it and spreading it? But it is a bird flu. This guy that they tell you have it, he was mingling with sick and dead birds, and that's how he get it. How did the cow get it? Oh, the same thing. He fondling birds, dead birds, and sick birds. That's what give these cattle the bird flu in the raw milk. Do you get it? Listen some more before we kick them out of here.
Happening. And again, if the more people get exposed to this virus, the more likely you are to see a mutation that will allow for human-to-human transmission.
Yes, so the more you see it, the more you see them alarm it, that you catch it from an animal, the closer they're getting to tell you it's gonna spread from human to human. That's what that fucker just said out the mouth. Just like I told you, they're coaching you till they get to that point. Do you understand that? The whole thing is a hoax, but they have to use word of mouth and show you these news clips that gonna lead up to it mutating, where humans to human transmission gonna happen. That's what they're gonna tell you. And then you're gonna have a pandemic right there, the next pandemic, and it's not gonna be as smooth or, light like the last one that you passed by, because now they have the pandemic treaty where the government people gonna tell you exactly what you need to do. No states, no city, no what they would call mayor or governor can change it. It's just gonna be what they said from the top, trigger down to every single human beings, and they have to follow suit. Yes, another mag, bam, I'm gone.